The journey of 10 years in devolution has been very transformative and more so a continued learning curve for counties. For a system of governance that came into effect in 2013, 50 years down the line after Kenya attained its independence, the story of devolution has moved on high and lows, defining the hurdles that come with the dispensation of new government systems. However, though counties in their mandates anchored in the Constitution have moved with speed, even along the bump and hard system of resource allocations to make positive changes to the lives of the community in their regions. Kilifi County has also been in the journey of transforming lives through devolution. The ease of giving out services to the people and development of its key infrastructure is a sign of the strength that counties need to survive and meet the goals of devolution. As counties meet for the first biennial summit termed 10 years of devolution, the present and future.
Kenya is very good, very good. Very good town, very good.
Kilifi County has taken strides in addressing key areas such as the urban development, affirmative action, natural resources management, health, improved roads infrastructure, agriculture, and trade. Almost a year after his election, Kilifi Governor GIDEON has been up and about, setting up policies and hitting the ground to improve the livelihood of the people, geared towards moving Kilifi forward. Governor MUNG'ARO has made tremendous efforts to improve and implement various departmental projects, sorting for partner and donor engagement, incorporating technical expertise people, and enhance stakeholder engagement on county development programs. Kilifi has made tremendous efforts to address the health sector as one of the key pillars of Governor MUNG'ARO's administration. This is the situation the governor met on his humble visit across health facilities that prompted him to swiftly take drastic measures and put health as a big priority in his administration.
Mimi tunakwambia hivi, chakula tunachokipewa ni kidogo chenyewe, tumeuma humu guu na tunapewa chakula kidogo.
Afya tumejaribu sana kuweka mikakati ya kuboresha hospitali zetu. Zile ambazo zimekuwa mbovu tumejaribu kuendelea kuzirekebisha. Tumeanza pale Malindi hospitali, hivi karibuni tutafungua rasmi hospitali ambayo imerekebishwa. Tumeanza kutengeza kituo cha usafishaji figo katika hospitali kuu ya hapa Kilifi. Hiyo pia inaendelea na hivi karibuni tutafungua.
In his 100 days in office, the governor procured drugs worth over 400 million, in which all the 150 health facilities in the county were equipped with drugs, as Kilifi became the first county to clear its debt with the Kenya Medical Supply Agency, KEMSA. Kilifi County Executive Committee member in charge of health, Peter Mwarogo, says the outcry of locals because of lack of drugs in county health facilities was the major headache when they came to office, and there was an urgent need to have the facilities equipped with the drugs and non-pharmaceuticals.
First of all, when we came in, one of the biggest cries of the people of Kilifi was the lack of drugs and pharmaceuticals in our health facilities. We have 150 health facilities in this county, and people were complaining that they were going to health facilities and they were not getting any drugs. They were getting prescriptions to go to pharmacies to procure. So that was one of our immediate concern. We started by making sure that we cleared the debts at KEMSA and procured drugs and started the distribution of drugs in the entire county.
The Department of Health has undertaken a number of infrastructural development, including equipping Marafa Hospital in Magarin Sub-County with modern surgical equipment and installing new 110 modern patient beds, a major renovation of Malindi Hospital and a new dialysis center at Kilifi County Hospital, and also the upgrading and equipping of Mtwapa Hospital in Kilifi South.
Afya ni kitu muhimu sana. Wamombo wanasema a healthy nation is a wealthy nation. And I can say kama kuna achievements kubwa zenye asilimia kubwa sasa hivi ndani ya mwaka mmoja wa ugatuzi, nitasema ni kwa upande wa afya. Tumeibeba, manake Kilifi ni jimbo ambalo lajulikana kwa utalii, linalojulikana kwa watu wengi. Tulirithi hospitali ambazo zilikuwa hazina madawa. Tulipokuwa katika mbio zetu za kutafuta kura, kila sehemu tulilokwenda hakuna madawa, hakuna ambulance, hazina mafuta, wafanyakazi hawatoshi ama hawapatikani. Ikifika masaa ya usiku wako missing. Lakini tukaona tumefanya steps nzuri. Jambo la kwanza, tulisema ndani ya siku 100 tutakwenda kuleta madawa, na ilipofika siku ya 90th day tuliweza kutimiza hilo. Tuliweka madawa katika hospitali zetu zote level 4 na hata zile zingine up to dispensary. Kwa kipindi fulani hivi kuna second consignment ya madawa ambayo imewafikia, lakini hilo lilikuwa ni jambo ambalo tumeweza kuachieve and we are so proud of it. Jambo lingine, tukahakikisha huduma za ambulance zinapatikana haswa katika hizi hospitali zetu kubwa, na hivi tumeprocure ambulance zingine ambazo zina virutubisho vyote, such it's like an ICU, upgraded ambulances 4 ambazo tayari ziko procured katika hii financial year. Tumeweza kufanya camps shikana na hata wale stakeholders za macho, eye clinics, tumefanya za fistula, tumefanya open heart surgeries za pediatric. Zote hizo ili kuangalia mwana Kilifi aweze kuendelea. Kwa upande wa maternity, tumeweza kuhakikisha ya kwamba maternity zetu zina ile hot water. Maana katika kampeni zetu, jambo moja kubwa tunasikia kina mama wakija hapa Kilifi Hospital wanakwenda kujifungua, lazima wanunue maji ambayo yamewekwa katika flasks. Ukitaka kama flask ndogo shilingi 50, ukitaka flask kubwa shilingi 100. Na tunaelewa kwamba mwanamke akijifungua normal lazima apate maji ya moto ajichome yeye mwenyewe na mtoto wake apate kumstiri. Lakini hilo tumelitupa katika kaburi la sahau, maana tumehakikisha serikali hii ya GIDEON MUNG'ARO na kina mama zetu ndio wanatuletea the president, the governors we are seeing today. Lazima pia na wao wakijifungua wapate mahali pazuri.
The department is set to provide high-end services, install state-of-the-art health management system, and also enhance human resource for better health and quality services to the people.
We have, as I said, broadened the scope of services, and that goes with infrastructure. We have established renal dialysis unit at the county referral hospital. Remember, renal dialysis was only being conducted in Malindi Sub-County Hospital, but now this is the county referral hospital. We have initiated that service. We are just waiting for some samples, water samples, and I think we are ready to go. And renal services, very critical services. We have also procured 13 additional ICU beds for this county, so we are broadening the scope of intensive care unit in our hospital. Now we'll be able to accommodate more at once. So that service is also going to be available in this county referral hospital. We are procuring one of the very sophisticated machine. It's called an ECG machines. We are procuring actually 4 of them. When you have a heart condition, that is the machine that will be able to diagnose what kind of heart disease that is also procured, and we are expecting to start to initiate that service in this county as early as next week. Theaters, yes, we have right now as we speak operational theaters for Bamba. Bamba is operating. Rabai, we have operations going on. We are in the final planning stages to start renovating the theater in Jibana Hospital and Gede Hospital. So we are going to have at least comprehensive services, especially for our mothers in all the sub-counties, so that a cesarean section will not have to be referred to the county referral hospital, for example, but those surgeries will be swiftly conducted in the sub-counties. Our idea is to have hubs. We are investing heavily on infrastructure to have hubs in every sub-county. These hubs will act as referral facilities for those sub-counties before the patients are referred to our main referral hospitals, which is Kilifi, Malindi, and Mariakani. We are already equipping Mtwapa. Mtwapa is also a level 4 hospital. We are already equipping Mtwapa to start conducting surgeries in a couple of weeks. We have already finalized, in fact, the handing over for the building, which was constructed through collaboration with national government and the Equalization Fund, will be handed over to us on the 3rd of August by the national government. And immediately after that, we should be able to start services as a hospital in Mtwapa.
With many families and residents failing to get good medical services because of several life challenges, including poverty, the county government went ahead to register 8,000 people on NHIF, with the governor saying that the devolved government has allocated another 60 million for the registration of another batch of 20,000 people under NHIF.
Tumeandikisha sahihi watu zaidi ya 8,000 kwa mradi wa NHIF. Tumeweka milioni nyingine 60 kuhakikisha kwamba kufikia mwisho wa mwaka huu tutakuwa tumeandikisha watu 20,000 katika bima ya NHIF ili kusaidia wale ambao hawajiwezi. Vile vile katika afya tumesema kwamba tutajenga vituo vipya vya wagonjwa wa majanga ama wa ajali pale Malindi, Kilifi na Mariakani. Hiyo pia iko katika bajeti yetu. Ni malengo yetu kwamba mwaka mmoja ujao tutaweza kuona ile tumeboresha masuala ya afya katika kaunti hii. Tumeweza pia kuhakikisha kwamba tunaanzisha kikosi maalum cha dharura cha hospitali paramedic, ambao tumeshachukua vijana 32 washafundishwa kwenda kwa mafunzo. Tumenunua magari mapya ya wagonjwa mahututi, yani ambulansi. Tutapia anzisha hizi wiki 2 zijazo.
MUNG'ARO says he is committed to saving lives of the people and has directed his health team to identify and map out dispensaries and health centers that will be used as mini referrals that are full equipped with emergency and life-saving equipment and medical personnel.
Tumeanzisha kituo hiki ili tuweze kuhakikisha kwamba wale wafanyakazi ambao wako hospitali sasa hatuwatoi tena kwenda kudili na majanga. Na hiyo ni sehemu moja pia ambayo tunajizatiti katika bajeti hii kwamba tuweze kuandika wauguzi zaidi, sababu tuko na vituo vingi vya zahanati katika kaunti hii karibu 150, lakini sasa wauguzi ni wachache. Hiyo ni ya kwanza. Ya pili, tumesema kwamba badala ya kwamba wodi moja ina zahanati 5 na zote tu ziko katika level moja, tumesema tunaanza mikakati ya kwamba kila wodi kuwe na zahanati moja ambayo ndio itakuwa kama referral ya hiyo wodi. Yaani ambapo ukienda zahanati yote ya huko, ile zahanati ambayo inaweza kupatikana kila kitu katika sehemu moja.
Patients receiving medications now are full of life and hope that their tomorrow is promising back to their families, as locals and residents cheer the progressive improvement and development across all health facilities.
Huduma hapa si mbaya, ni nzuri, zinafanya vizuri. Daktari ukimuita anakushughulikia kwa haraka. Na wakati ulikuwa ile wodi ile pale ilikuwa hali yake si nzuri, lakini hii ikawa ikatengeneza hii ikawa sawa, ndio tukahamishwa kule tukaletwa sehemu hii. Ikawa ile huduma hapa ni nzuri, na pia usafi ukawa umesingatiwa ukawa unaendelea vizuri. Kwa hivyo kwa upande huo, na pia huduma ukiita daktari kama ni huduma hapa anakushughulikia vile inawezekana. Mambo si mabaya hivyo. Kwa sababu mimi nilikuwa na shida ya mguu, lakini hiyo miezi 3 sasa kama nimepona, na pia nashukuru Mungu. Wakati huu mambo imebadilika. Ile mhesabu kulala watu 2 ama ni wamepungua, sasa ni mmoja, na pia huo usafi nimeona wamejaribu sana. Hiyo imejaribu sana ule usafi, naona ni mzuri kulingana na ule muda ambao nimekaa hapa.
Huduma ya hapa ni mzuri, imeimprove, sio kama hapo mbele. Kwa ufupi inaridhisha. Facility mimi naona zimeimprove. Pia usafi pia nimejaribu. Sanitization pia ni mzuri, imeimprove pia. So nafikiri kwa upande wangu tunaendelea vizuri. Tuzidi kwa tutenda juu zaidi ya kiwango hiki. Nampa pongezi mheshimiwa, amejaribu sana, hasa upande wa sekta ya afya ya Malindi. Namshukuru sana, nampatia heko na kazi yake. Awe na moyo huo wa kuendelea kutujengea hospitali yetu iwe nzuri na iwe itakuwa bora zaidi.
Kwa jumla huduma za afya tunashukuru kwa zilivyoboreshwa kwa kuletewa jengo mpya hili, na huduma ambazo kwa kufikia sasa zimepunguza ile gharama ya usafiri, ambapo tulikuwa tukisafiri hadi Malindi kutafuta huduma nyinginezo. Lakini kufikia sasa hizo huduma wale wagonjwa wetu ama wakaaji wa Marafa wanazipata kwa urahisi, ni karibu, na pia hata kwa yale malipo ambayo wanatozwa wale wagonjwa wetu ni ya nafuu. Tunayo furaha kubwa kwa kuwa MUNG'ARO ameibadilisha Marafa, ameibadilisha Magarini, ameipa sura mpya, na si Marafa tu peke yake bali kwa kaunti nzima ya Kilifi. Ninaona hili swala la afya amelitilia mkazo ili kuhakikisha kila mwananchi wa Kilifi na wa Kenya nzima kwa ujumla anapata huduma iliyo sawa.
Nashukuru sana kwa huduma ya wakati wa hapo nyuma, wagonjwa hata wanaweza lala wawili, vitanda havitoshi, halafu hao wagonjwa hakuna madawa, halafu tena madaktari ni wakungojea. Lakini saa hii naona tuko sawa. Saa hii vile tunavyoona madaktari wanakaa hapa, yani wanafanya kazi zao vile vinavyotakikana. Anaendelea na shift yake, akimaliza anaenda mwanzake anaingia. Hakuna mambo na kungojea, wagonjwa wangojee, hakuna mambo ya kungojea. Kwa hivyo tunaona hiyo hali ni nzuri.
Kilifi's goal to become a huge medical tourism destination is crawling to its realization with availability of a regional public health referral laboratory in Malindi that conducts tests within and across counties.
This lab is accredited ISO 15189 of 2012, and this is one of the major facilities we have in this county. This laboratory serves the whole of Kilifi County and also our neighboring counties, Lamu and Tana River. Our test menu is wide. We are doing a lot of tests, including molecular work. This lab was very important during COVID time. It was one of the COVID testing laboratories in the country, providing the data and shipping and sending the data to the national data repository. In fact, this lab is very important as a surveillance laboratory because we have the facility, molecular equipment, which are important for disease surveillance. So Malindi being a tourist destination, we are good to go. We are ready to test any diseases and to take care of the tourist people who come around here. In fact, this facility, going forward, we need to work with universities. We need to work with research institutions because the way we have the necessary equipment to do even molecular work. So we are urging students, researchers who have their own grants, they can come here and do their research work in our laboratory.
Another milestone in the health sector in Kilifi is the setting up of Revital Healthcare, one of Africa's largest medical device manufacturer. Located at Kikambala in Kilifi South, Revital Healthcare exports its health products to more than 30 countries around the world, including the United Kingdom, Thailand, and India, among many others. This is the first of its own across Eastern Central Africa to own a large medical manufacturing company that has attracted international organizations like the Bill and Melinda Gates Foundation, several international accreditations from World Health Organization, alongside an ISO accreditation.
Revital Healthcare is a state-of-the-art medical disposable manufacturer based right here in Kilifi County. We manufacture over 48 medical devices and export to more than 30 countries around the world right here from Kilifi County. Some of the accomplishments that we've done in the past few years, and especially since we relocated ourselves from Mombasa County to Kilifi County in 2018. At the peak of COVID-19, Revital Healthcare was based in Kilifi County, exported 1 out of every 10 COVID-19 syringes used globally for COVID-19 vaccinations. This became one of the biggest achievements, and after this, we got several grant opportunities from Bill and Melinda Gates Foundation, who gave us a grant for $4 million to manufacture and produce the first ever early activation syringe in Africa. This is the first time ever in history of Africa where we're not following, but we're now in the space of technology and innovation. So we're the first company in Africa to have this specialized syringe out of 4 manufacturers in the world, and this is right here in Kilifi County. Some of the other accomplishments that we have recently done is a new grant that we have received from USAID. This is actually going to house Africa's largest rapid diagnostic test kits factory with a capacity of 20 million tests per month, manufactured right here in Kilifi for the world. This is going to be again a WHO PQS approved facility which will enable us to manufacture products such as HIV test kits, malaria test kits, hepatitis test kits, dengue, livestock, drugs of abuse, and much more. This is all possible through the collaborations of USAID, PATH, Bill and Melinda Gates Foundation, FIND, and many more such organizations who are currently seeing Kenya in the map of Africa to be the leader in space of innovation, technology, and healthcare. We want to make sure Kilifi County is put in the map not only of Kenya, but is put in the map not only on Africa, but the entire world, because Kilifi County brings lots of opportunities. 5 minutes down this way, and we're next to one of the best beaches in the world. 5 minutes this way, and we go to a whole line of industries, from garments which are exported to the US, cooking oil factories, cement factories, and now Revital Healthcare as the only technical industry in Kilifi County. Right now, we have got companies from Canada, from Europe, from America, who are all currently manufacturing their innovative devices and technology patented products in China and India. You'll not believe they want to shift their manufacturing from China and India to Kenya and right here in Kilifi County, because we have the facility. We have an amazing people over here in Kilifi County who are highly educated, highly trained as well. And so we understand the possibilities of why we have a lot of foreign investments coming specifically in Kilifi County. So Kilifi County is not only a county for coming to enjoy for a nice, beautiful holiday by the beach, but it's also a county where you can now enforce manufacturing capacities, because it has water, it has electricity, it has adequate land, it has adequate staff to employ in your companies. So it has everything that a manufacturer would look into when it comes to Kilifi County. The governor is very much behind local manufacturers, especially within his own county. I mean, we had the opportunity to meet him in Dubai. He came to us for the 2023 Arab Health Show, and it was quite amazing to see my own governor coming to my stand, congratulating me, having a presence globally in Dubai to market not only, of course, Revital Healthcare, but Kilifi County is a county of potential, as a county which has immense potential. So this county and the governor and the team behind the governor are an amazing team. They've contributed a lot to local companies, and I know for the next 4 years or 5 years of this administration and more, we will be able to incorporate a lot more ideas through the collaborations of the county government.
As Kilifi presents itself in this devolution conference, the county is ready to become a world-class example in healthcare and has opened its doors for more partners and players in the health sector.